You are listening to Wellness Prescribed with Fisher-Titus Medical Center. And joining us now, Dr. Eli Ross here from Fisher-Titus Family Medicine in Bellevue. So here to talk about just kind of communicating with your provider and how to navigate your appointments. So thank you for joining us today to talk about these things.
No, thank you.
So with this, how often should you really visit your healthcare providers?
So that's a good question. So it really all depends on what kind of complications or medical problems you have. There's some standard research that says, for high blood pressure, you should see your doctor at least twice a year. But really, then it comes down to an art of a physician. If I have a more frail patient who, lives by themselves, I may want to see them every month, may want to see them every couple months. So it's not a hard science, but it's also making sure that we treat our patients individually. And so the answer is you should really rely on your physician and even ask the question why. Hey, doc, why do you want to see me back every 3 months? Or, hey, why would you like to see me once a year? This all helps.
All right. So with that, then, what is the best way that somebody can make their preparations to see their provider then? What should they do getting ready to go into this appointment?
So I think every patient should kind of prepare, plan, think about the questions you want answered. If there's 5 issues that you have, maybe this month you want to make sure your blood sugar is under control, your blood pressure is taken care of, and then that knee pain that's been bothering you for 3 to 6 months, you're finally wanting to talk about it. List those out, list the questions you have about those, and then plan them with your priorities. So maybe your knee pain, since you've been letting it go for the last 6 months, is your number one priority. And your blood pressure maybe not as prioritized. Write them down, because I may not be able to get to the whole list today, but we should be able to talk about that going forward.
So should you bring every health concern that you have in one visit to your physician, or should you just bring a couple at a time?
So I think for the first visit, you should bring all of your concerns. Do it in a very quick way. Maybe list them out and then plan accordingly with your physician. You may not be able to get to all of them. Maybe you can do 2 today and 3 the next month, or 6 the month after. Mm-hmm. But in order to do it, you need to be able to plan and understand that we may not hit everything today. Remember, physicians only have about 15 to 20 minutes to actually see you in an appointment. You want to be able to understand those complaints and issues. If you have cancer, I only want to talk about your cancer at that one visit. I want to be able to make sure that you understand appropriately what's going on, how we're going to move forward, what to do next. And in planning, in those types of appointments, I want you to bring a friend. Because if you hear something and you're like, oh man, I don't remember that. If your friend's sitting next to you, they'll be able to help you remember, hey, the doctor said you're going to need to do this first. When you ever get a bad diagnosis, sometimes your mind is swirling in 150 directions, and I'm wanting to have a conversation with you about what we're doing, and you can't pay attention. That's totally normal. We expect that. So if you bring a friend to your appointment, it's really helpful to help remember what the physician talked to you about.
Okay, so before you get that diagnosis then, when you're coming in to meet with somebody, what is the best way to effectively describe maybe the symptoms that you're experiencing or the concerns that you have? If you've got this limited amount of time to list all of these things that you're experiencing.
I think having that conversation, sometimes even bouncing it off of somebody else, a family member saying, it hurts like this, one of your friends may have already had knee surgery, and maybe you're trying to describe that knee pain like it's right here and it bothers me every time I walk down the stairs. Oh, I had that too. It doesn't mean that that's necessarily the same diagnosis, but it can help you kind of put that pain or that symptom in a relative term. I like to also use things to help correlate. So like the heart, I talk about like a water pump. A lot of people understand the water pump or an engine in a car. We'll talk about things in those manners to help you relate, and then you can relate your symptoms back to something else. It kind of brings that medical terminology, not so scary, into your realm and understanding how your body works.
Okay, so kind of building off of that then for, talking about things that might be scary, but there's also things that might be embarrassing for a patient to talk about. So what's the best way to discuss those things that might be more embarrassing for a patient that they might feel uncomfortable talking about?
That's a really good question, because this is not only uncomfortable sometimes for the patient, but it also can be uncomfortable for the physician. And so one of the things that I do is understand that at every well visit we're going to talk about sexual health, which is going to be very uncomfortable. But if every year we're going to talk about it, you're going to understand, okay, then I can bring my concerns. I don't have to feel like I have to make an appointment just for that. You know that on this day, every year, we're going to have that conversation. And that kind of helps bring some of that stigma down. The other thing is understand that there's not much that we haven't heard or seen. And so that's the case. Just come into it and relax. If you don't want to talk to my nurse about it, it's totally fine. Just say, I don't feel comfortable talking about that. I just want to talk to the provider about it when it comes. My nurses understand that's a cue for them to say, hey, doc, there may be something sensitive for this patient that we want to talk about. And so when I go in, I can just say, hey, what's the deal?
Yeah.
And what's going on? And just trying to lighten that mood a little bit. And then you can see the weight just kind of flow out of them. Like, just remember, there's nothing that I haven't heard before. If you don't feel if you don't feel comfortable, maybe we ask the person you brought to step out. Especially with kids. Sometimes kids feel very uncomfortable, especially as they're getting to that 18 years and mom still wants to be there in the room. Sometimes we can say, hey, mom, it'd just be kind of nice. Why don't you take a step out? Let me have a conversation, and then we'll bring you back in when it's appropriate.
So then with that, what about communicating concerns about privacy and confidentiality then too?
So this is a really hard one in this day and age, because with social media and all the other things, and actually being in a small town is probably one of the hardest things, because everybody knows everybody. They'll call you and say, I saw you walk into the doctor's office.
Yeah.
It's one of those where, okay, that maybe we shouldn't be talking about that. But understand, if you tell the physician, hey, this is something I want to keep private, here's who I do and don't want to know this stuff, we'll usually mark that down. When it comes to a kid, just remember that we are bound by confidentiality for the government. If a kid came to me and said, hey, I want to talk about sex, drugs, and alcohol, or anything in those lines, I can't tell the parent.
Even if they're a minor?
Even if they're a minor.
Okay.
So, but I also tell the kids, your parents have the right to your records. So we have to understand that there's this play. They're going to see a bill. They're going to see that you came and saw me. They're going to ask you questions. So I give that conversation up front to my teenagers, that I want to talk to you about these things, and I want you to understand that we can have those confidential questions. I don't have to. I can document it in such a way that it keeps your privacy, that we don't disclose everything. But do know that your parents are going to find something, and they're going to ask some questions.
Sure.
I'm not going to answer those, but just know that they're going to be looking. They're going to want to know why you went to the doctor without them knowing.
All right. So with this then, what if I have found some different treatment options and I have opinions about my health care? Then can I bring that up to you? Or is that kind of like, well, you're the doctor, what you know is best? Do you have any say in this, or how does that work?
Well, I'm of the belief that all patients have the right to their own treatment within guidelines. I think that if you came to me and said, hey, doc, I'd like to go with this treatment, if I believe that treatment's actually ultimately going to hurt you, we're going to have to say, hey, that's not for me. You can find somebody else. I'm not, and I'll support you by finding somebody that maybe supports that decision. But in most things, let's talk about high cholesterol. We'll probably talk about multiple options. We'll talk about, is diet and exercise right for you? Is starting a cholesterol medication right for you? What are the right options for you? We'll already have that conversation, and I encourage patients to be informed and bring me their questions and what their options are. When you come to a physician, it shouldn't be, this is what you have to do. It should be, here's what you can do to best improve your health. I'm thought of as a health coach in those situations and not a dictator.
Yeah, well, great. And then I assume, though, that is also a way then that helps to maintain a positive provider-patient relationship by basically everything that we've talked about so far.
Exactly. And I think that's the main reason for this whole topic is to keep that relationship in a very positive and a healthy way. I want to look forward to seeing you in my office. I want to look forward to seeing and say, hey, how's your kids? How's life? What's going on? And then get into what is it really bothering you today? What can we do to help you? What can we make, how can we make your life so much better? And that may mean hard conversations. It may mean end of life conversations. It may mean cancer conversations. But what it means is that you and I have such a good relationship that no matter what the conversation is, we're going to have a good and productive meeting.
All right, so talking again with Dr. Eli Ross from Fisher-Titus Family Medicine in Bellevue. Can you tell us a bit about the My Fisher-Titus patient portal and how that is a useful tool for a patient?
So I love the My Fisher-Titus portal. Reason being is that it's one of those ways that you can get to communicate to my office in a very quick and timely manner. You can request refills, you can request a visit, you can ask questions, all through the portal, and you're not having to wait for a response. We review them all the questions once a day to make sure that we can get back to you in a timely manner. And I think this time, this is something that instead of having a phone call, it goes straight to the office and helps us prioritize what needs to be addressed and what can wait.
Wow, yeah, that's a really nice thing that you have, and I'm sure very convenient for people
Extremely.
as well. So where is your office located? We mentioned it is the Bellevue office there, and are you accepting new patients? Are other providers accepting new patients?
We are, and I have two wonderful nurse practitioners that have been in the area for a very long time. We do a collaborative work, which I love. If they see one of my patients, we have a conversation about it. Hey, I just saw so-and-so. This is what I did. This is what I changed. So we keep that going. Sometimes I have to see the nurse practitioner's patients. They're out for the week. They're on vacation. They come and see me. And when they get back, I say, hey, guess what? I saw a patient so-and-so. This is what I did. And this way we have a fluid relationship between the nurse practitioners and myself, and this really helps. And to answer your question about where we're located at 512 North Sandusky Street in Bellevue. And yes, we're always accepting new patients.
All right, so if people want more information or to get in contact with you, what is the best way to do that?
Yeah, you can find more information at Fisher-Titus.org.
All right, well, Dr. Eli Ross again, Fisher-Titus Family Medicine in Bellevue. Thank you so much for taking the time to talk with us today.
No, thank you. It's been a privilege.
You've been listening to Wellness Prescribed with Fisher-Titus Medical Center.